Joined now by Dr. Kim Bergner. She's a pediatrician in the Boston area and a board member on Healthcare for Action. Doctor, good morning to you. You heard what the MAHA moms say about vaccines and herd immunity. What's your reaction?
Good morning. Thanks for having me. I think what the MAHA moms are saying is part and parcel of basically anti-science and anti-expert movement that's becoming a part of the American culture or sectors of the American culture. And frankly, I think it's dangerous to give decision-making about public health and children's health entirely in the hands of people who are not trained and not experienced in making those decisions. I think that patients and parents should be part of decision-making always, but people have to take responsibility for where they get their information and to respect the people who have vast amounts of training and expertise.
Talk to us about what happens if this committee does, in fact, change the recommendations for vaccination. For instance, when it comes to hepatitis B, why is that so important to be vaccinated as a newborn for Hep B?
So hepatitis B is transmitted, in a number of different ways, and infants are at risk of contracting hepatitis B during birth. From mothers who may be carrying hepatitis B and aren't aware of it. We do have screening for pregnant women, but that screening is not perfect and not everybody gets all the screening that they need to be getting. So so to protect the newborns from contracting hepatitis B, it is recommended that they get a very safe vaccine at birth. It used to be that they would get the vaccine prior to discharge if we knew that the mother had been vaccinated previously. Now at my hospital and at many in the Massachusetts Department of Public Health recommends that it's given within the first 24 hours. Because if they're going to be getting the vaccine anyway, they should get it when it's most protective, where if they have been exposed to the virus through their mother during the birth process, it's most protective if given during the first 24 hours after birth. As Senator Cassidy pointed out, Senator Cassidy, Republican from Louisiana, who is a liver specialist, a physician, he pointed out that childhood hepatitis rates have decreased from 20,000 per year in America to 20 per year in America since giving vaccine in the newborn period. And the earlier that someone contracts hepatitis B, the more likely that they will end up with chronic and fulminant liver failure. So it's really important.
Dr. Bergner, thanks for being here on Connecting America to weigh in from the scientific community and hear from a doctor after we heard from the moms yesterday talking about personal choice.